Good morning. My name is Bill Temple, Branch Chief for Injury Prevention and Trauma at the Arkansas Department of Health. I'd like to welcome you to the Trauma Video Workshop, which is sponsored by the Arkansas Department of Health, the Arkansas Hospital Association, the Arkansas Medical Society, and the Arkansas Department of Information Systems. As many of you know, the legislature passed the Trauma System Act in 2009. The purpose of this workshop is to provide hospitals that are seeking designation as trauma centers under the Act with important and useful information. During the video, I'll be providing information on a couple of topics, the first of which is why the trauma system is important to Arkansas, and the second of which relates to funding issues. You will also be hearing from a variety of medical experts in the trauma field who will be providing information on the nuts and bolts of what the hospitals will need to do to function within the system. One of these experts is Dr. Todd Maxson, who is the Trauma Medical Director at Children's Hospital here in Little Rock, and also serves as a medical consultant to the Arkansas Department of Health, assisting us with the implementation of the trauma system. I'd also like to note that these video segments were filmed during December 2009 and January 2010. Now, you can see on your screen some of my contact information, and I'll give you just a second to make sure you have time to copy this down. But the point I want to make here is that our goal at the Arkansas Department of Health is to be extremely responsive to the hospitals and the administrators and anyone else who calls in with questions regarding the trauma system. I'd encourage you to call or email me with those questions, and I can promise you I'll be as responsive as I possibly can. So with that said, let's get started with the workshop. The first thing I'd like to do is state the problem here in Arkansas. Injury is the #1 killer of Arkansans between the ages of 1 and 44. Arkansas's overall injury fatality rate is 50% higher than the national average, and it's 60% higher when we talk about motor vehicle crashes. And this is 2008 data from the American College of Surgeons. Another problem we have is that the pre-hospital times are long here in Arkansas, and this is actually exacerbated by the fact that Arkansas has the 12th largest rural road system in the nation. Another problem, we have a limited number of specialized resources for our hospitals and medical clinics around the state. This is in terms of specialized surgeons and nurses, anesthesiologists, and equipment needed to perform work on trauma patients. We have no statewide trauma system, and Arkansas is the only state in the country without a designated and verified trauma center. Our state's emergency care system is actually the worst in the country, and this came from the National Report Card of the State of Emergency Medicine in December of 2008. The lack of a statewide trauma system cost Arkansans $193 million a year just when you're talking about motor vehicle deaths. And you also have a problem of perception versus reality. You know, most people here in Arkansas believe that there's a trauma system in place and that they're going to get the best possible care if they are seriously injured in an accident. And unfortunately, that's not the case. Now that we've been through some of the problems here in the state, let me just give you the good news. Many injuries and subsequent deaths are certainly preventable. In recognition of these problems that I've just stated, the Arkansas legislature in 2009 passed Act 393, which is known as the Trauma System Act. This act became effective on July 1st of 2009. What is a trauma system? We can define it as an organized and coordinated plan within a state that is integrated with the local public health system and delivers the full range of care to patients with severe or life-threatening injuries. Let's talk for a moment about the components of a trauma system. These are the places where the patients actually come into contact with the system. First, you've got the emergency medical services phase, This is the pre-hospital part of where the patient will encounter the system. Secondly, you've got contact within the trauma centers themselves. And third, of course, we have the rehabilitation piece. When we think about the components of a trauma system, many people might focus in on the clinical care aspect within a trauma center. But in reality, a trauma system is much more than that. In addition to the clinical component, we have education, dealing with educating not only physicians, nurses, everybody associated with the trauma system. You've got research, which will expand the base of knowledge we all need to take better care of the patients. And then you've got the community outreach component, which basically involves injury prevention and control. Critical to all these components that I've just mentioned is the trauma registry, which is basically a data collection system which will drive decisions concerning the components such as rehabilitation, education, community outreach, and the like. Let's talk for a moment about the benefits of a trauma system. First, what we're really talking about here is getting the injured patient to the right care in the most timely manner possible. The most efficient and effective way we can get those patients to definitive care is what this system will do for us. That first hour following the injury, some people refer to it as the golden hour, the first 60 minutes after the injury. We really want to get folks to the right places to get the right care in that golden hour. And I think this system is going to allow us to do that once we get things like the call center and the communications piece in, and have all our EMS providers out there on the same wavelength. It's going to help us get the injured patients to the right care. As a result of this efficient moving of patients that I just discussed, we should see a reduction in mortality as well as a significant cost saving in terms of lives lost. And those are obviously critical components of this whole system. Now, that being said, I think it's important to note that the national data shows that it takes a significant period of time for a trauma system to actually show results in terms of decreased mortality. And the national data actually shows that it takes 7 years to see the full benefits of the system. But I believe, in talking with the experts that I have, we have a chance here in Arkansas to reduce that time period pretty significantly. And that's a great thing. But the bottom line is, this system will save lives.